Well, it's time now for your weekend wellness. A new male contraceptive may be hitting the market by the end of the decade. And here with the details on that and what they don't tell you about women's birth control is Fox News medical contributor Dr. Nicole Saphier. And she joins us now. So before we get to male contraception and what's on the horizon, let's just talk about the birth control pill. Why? It seems like it's kind of a taboo subject, like in terms of the actual effects beyond preventing pregnancy. It has a lot of side effects that really don't get talked a lot about.
Well, the access to contraception on a global scale has actually led to a decrease in fertility rates in many countries. Here in the United States, about 65% of women who are of childbearing age are on some form of contraception, oral contraceptive pills, the most common, many of which began these oral contraceptive pills while they're in adolescence. And one of the things that is not as talked about is what happens when teenagers or younger women start these medications. It has physical and psychological effects. In fact, a huge study looked at over 1 million women it was a Danish study, and essentially showed the increased risk of depression, anxiety, suicide attempts. And unfortunately, about 70% of women on oral contraceptives were also on antidepressants. So it's like this endless cycle of antidepressants and hormones and so much and so forth. And it continues on throughout adulthood. And so while we have talked about the increased risk of cardiovascular disease, some cancers, and some other things like known side effects of birth control, there are bigger side effects that we just don't talk about. And these young girls are just giving them without really knowing the potential long-term consequences.
Yeah, they get them in adolescence, not just for pregnancy prevention. They'll say, well, it'll help your periods be less painful, or you need it for acne. So they get on it and they never get off of it for decades sometimes. And then that also can hurt their fertility into the future. Really quick, talk to me about attraction. I've been hearing a lot about people on birth control actually are attracted to more beta males. Is that true?
Well, there is some evolutionary data that suggests that women on contraceptives actually their change in who they're attracted to. They're attracted to facial features that are more feminine. They say it's because the hormones resemble that of pregnancy. Is it true? There are some studies that go both ways. But if you look at the trends, where all of a sudden you have this toxic masculinity and men not having masculine features, maybe it's because they're trying to attract all these women who are actually on contraceptives. One thing I want to point out,
fascinating.
SSRIs or antidepressants have black box warnings because they are known to increase your risk of suicide ideations. Well, we have data that shows birth control can do the exact same in teenagers. Why don't we have a black box warning there? We don't talk about it nearly as much.
Oh, I'm so glad you're talking about this. So tell me quick about the male birth control pill. Is that a real thing?
Well, women just don't think it's fair. But yes, they have been studying male birth control for a while, usually hormonal ones that decreases their testosterone. Shocking, males don't like the side effects. They're like, it makes me moody.
Women don't either.
It makes me gain weight. It's like, yes, those are all the things that happen to women as well. This is a new one. YCT 529 is the study name. It's a non-hormonal daily pill. It affects vitamin A metabolism, which is essential for spermatogenesis, or the creation of sperm. It's very early human trials, phase 1A. They're just looking at it. It had 16 volunteers in it, and it looked like it was safe in this very small short-term study. Are we going to see it on the market anytime soon? No, maybe in the next 5 to 10 years.
Okay. I don't think we should mess with men's testosterone. I don't think that's good for women.
Well, it doesn't affect their testosterone, but it does affect their sperm production.
All right. That's a problem too. All right, Dr. Nicole Saphier, always great information. So fascinating.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.